Hello everyone, I'm Dr. Sakshi Sethia. I'm a pediatric cardiology resident and this is my YouTube channel. I upload one lecture per week pertaining to either pediatrics or cardiology related topic. If you haven't already subscribed to my channel, please do subscribe. Today we'll discuss about vitamin B3, also known as niacin or niacinamide. But before jumping onto the topic proper, let's learn about this very interesting historical snippet. This oil painting by Giuseppe Mentesi is called Our Daily Bread, and it demonstrates the then existing scourge of Pellagra. Surrounded by a field of maize, we see a woman who's carrying her exhausted child in her arms, and she herself looks very much worn out. What had happened was, back in 1800s, northern Italy was facing an economic recession, and there prevailed a huge gap between supply and demand of wheat and other staple cereals. With its low cost and high yield, people started growing maize or corn. And soon, the entire fields across this region, the entire vineyards, pastures, forest, everything got replaced by maize fields. And maize became the staple food, especially for the poor peasants. At the same time, increasing number of these peasants, they started falling sick and developed a characteristic flaky rash on sun-exposed skin, which was termed as pellagra. Wherein pel means rough and agra means skin. Also, many of them had neuropsychiatric manifestations, so much so that mental asylums, they were fraught with patients labeled with pellagra's insanity. And a similar illness was also happening in the UK, and it was referred in UK as general paralysis of the insane. Researchers back then, they were able to associate this condition with corn-based diet. But it wasn't until years later that a deficiency of niacin in particular was attributed to the disease which we now remember as 4Ds, which is diarrhea, dementia, dermatitis leading on to death. After this very brief snippet, let's go on to learning about this particular vitamin in a systematic manner. We'll discuss it under the following headings. A very brief biochemical overview of niacin, its dietary sources, deficiency states with its clinical manifestations, labs, and finally treatment of the deficiency state. Niacin is a part of two cofactors, NAD and NADP. Both of these are required in hundreds of biochemical reactions, including ETC, steroid synthesis, fatty acid synthesis, etc. It is either ingested directly as niacin or the body synthesizes niacin using the ingested tryptophan, such that 1 milligram of niacin equivalent, it required 60 milligrams of tryptophan. Since it is involved in hundreds of biochemical reactions, its deficiency manifests in cells which have a high turnover rate or those with a high metabolic rate. And therefore, we have involvement of gut epithelium, nerve cells, and keratinocytes manifesting as diarrhea, dementia, dermatitis leading on to death. For non-vegetarians, the main source of niacin is fish, meat, and poultry, whereas for vegetarians, it is legumes, cereals excluding corn and maize, and green leafy vegetables, milk, and egg. They are poor sources of niacin, but they are rich in tryptophan, and therefore they do provide for niacin equivalents in the body. Corn or maize, as we already know, it is a poor source of both niacin as well as tryptophan, and therefore a diet which is essentially based on corn or maize, it manifests as pellagra. But these days, it is very rare to have a primary nutritional deficiency. Usually in people who have eating disorders like anorexia nervosa, can we expect a primary nutritional deficiency, or in kids who are grossly malnourished, they'll have a combined deficiency state of various micro and macronutrients. What is more often expected if we exclude the regions with endemic malnutrition, it is a metabolic deficiency state. We have two conditions which disturb tryptophan metabolism. The first is Carcinoid syndrome, and the second is Hartnup's disease. We'll read about these both. In carcinoid syndrome, as we have a neuroendocrine tumor, it consumes most of the tryptophan which is present in this cell to form serotonin. About 60% of tryptophan the dietary tryptophan, it is consumed by these tumor cells in the periphery to form serotonin, and therefore we have the symptoms of serotonin excess like flushing, diarrhea, abdominal cramps, etc. Also, since most of the tryptophan is consumed to form serotonin, there occurs a deficiency of niacin manifesting as pellagra-like manifestations. Now, just to complete carcinoid syndrome, associated with this peripheral excess of serotonin, there is a central deficiency of serotonin. This happens because most of the dietary tryptophan is consumed in the periphery to form serotonin, and less tryptophan crosses the blood-brain barrier to form serotonin. And therefore, centrally, we have a deficiency of serotonin. Peripherally, we have an excess of serotonin manifesting with the excess serotonin symptoms in periphery. And in brain, we have a serotonin brain depletion manifesting with the neuropsychiatric symptoms of deficiency of serotonin. The other disorder is Hartnup disease. It is an autosomal recessive disorder, and it may have afflicted Julius Caesar and his family, since many of them had neuropsychiatric and dermatological features of this disease. This happens because of a mutation in SLC6A19 gene. This gene codes for a transport protein called sodium-dependent neutral amino acid cotransporter system B0. This transport protein, it is present in brush border of gut epithelium and renal epithelium. So there's a malabsorption of neutral amino acids at the level of gut, and there is poor reabsorption of the same at the level of kidneys. But it mainly affects only tryptophan because there are other alternative pathways of absorption and reabsorption for other neutral amino acids, and therefore it manifests with features of pellagra. Any child who has typical features of pellagra but no significant dietary history pertaining to the same, you should think about Hartnup's disease. In children, we won't have a typical depression, disorientation, or delirium. We'd rather see apathy, irritability, anorexia, and anxiety. Then the dermatitis of pellagra, it has certain typical features. We all know that it affects the sun-exposed regions, and it can occur either suddenly or insidiously following an irritant exposure, which is usually sunlight. Initially, it appears just like a sunburn, symmetrical erythematous rashes on sun-exposed surface. But the typical feature is that it has sharp demarcation lines from the surrounding healthy tissue, giving it a collar-like appearance, which is also known as castle necklace. It has been named after a Spanish physician, Castle, and a similar finding in arms is known as glove and stalk pattern, glove and stalking appearance in upper limbs. And over here we can see intensely lichenified lesions with hyperpigmentation and sharp demarcation in this from the healthy skin, and all of these regions are lesions are distributed in the sun-exposed regions. We can also have vesicles and bullae, which can undergo suppuration, and later it can all heal, and even after healing they can leave hyperpigmented patchy marks. Over here we have a typical lichenified lesion in glove and stalking pattern. Because of the intense lichenification, it is also known as gauntlet of pellagra. This is what a gauntlet basically is. To diagnose, it's basically a clinical diagnosis with a rapid clinical response when niacin is supplemented. But for research purposes, and decrease in concentration of urinary niacin metabolites can aid in diagnosis. For management, if there is no issue with intestinal absorption, a 50 to 300 milligrams of oral niacin can be supplemented. But if the absorption is affected, if there is associated malabsorption, parenteral 100 milligrams of IV of niacin should be given. In case of Hartnup disease, up to 100 milligrams of niacin is given daily, orally, or tryptophan ethyl ester, which is a lipid-soluble form of tryptophan which can be easily absorbed from the intestine despite the problematic transporter protein. This can get absorbed. Either this or this has to be supplemented in diet. Then the patients should be encouraged to avoid sun exposure during the active phase of dermatitis. They should use sunscreens and cover up the skin lesions with emollients or moisturizers. Along with this, the diet should be fortified. So that is it about niacin.